Hey guys, today we're going to go over some emergency tracheostomy management situations. The first one is that you walk into the room and the patient's tracheostomy tube has become plugged. So you're going to look at your emergency airway management sign. The first thing is the patient breathing? If they are not breathing at this point, go ahead and call a CPR. If they are breathing, I'm going to call for help. I got Brian here to help me. He's going to check the oxygen level and apply oxygen via the trach mask. At this point, you're going to want to assess for tracheostomy patency. Remove the speaking valve if they have a speaking valve on the end here. Remove that. Can you pass a suction catheter? We got suction catheters right here in the drawer. You want to use sterile technique, but you'll grab your suction catheter. And attempt to pass it. If you can pass a suction catheter, follow over here. The tracheostomy tube is patent. You've performed tracheal suctioning at this point. Consider a partial obstruction. If they are slightly obstructed, you can ventilate them with the bag mask here. If you cannot pass a suction catheter, you've tried to put it down and it's not passing, you need to pull out the inner cannula at this point and see if there's a plug on the end of it. In order to pull out the inner cannula, you pinch the sides right here and gently pull this out. If there's a plug on the end, you'll see it right there. That would be your problem. Is the inner cannula patent? Yes. If it is patent, you continue over to here and you'll support with ventilation either via the trach mask or the ambu bag. If the inner cannula is not patent, you'll want to replace it with a new clean inner cannula, which will also be in your drawer here. Grab a clean one, put it back in, just like so. All right, so the second emergent scenario is that you walk in the room and the patient's trach tube has come out. So the algorithm is the bottom part of this chart here. First thing is the tracheostomy tube has come out. Is there distress or is there not? If respiratory distress is noted, at this point you're going to want to call the respiratory therapist. Brian here is going to help me out. You want to cover the stoma and ventilate with a bag mask valve. So I'm going to cover the stoma right here, and Brian's going to bag the patient like so. If the patient is not breathing, you want to call the CPR team at this point. So back to the beginning, your tracheostomy tube comes out, but your patient is not in any distress. So I would want to call the respiratory therapist. Hey, the tracheostomy tube has come out, and continue to monitor the patient at this time. Put the pulse ox on, we'll take a listen to him, just watch him really closely until the respiratory therapist gets here.